My mother always kept us connected through her love, and Dad was always about moving the cheese. So he always wanted to challenge us to do better, get better, not get comforted with whatever we are. 25 kilometers around Chennai was where I grew up, at least till 21 years of my age. Then I went on to study my engineering in a neighborhood of Chennai. Then I got my job in a company called Income ATL, which is one of the best medical companies. I was fortunate to get a job in that company. The opportunity I got was in ultrasound division. Healthcare, for some reason, continued to expand and get better in the metros. Whereas at the same speed, we are not seeing it happen in the rest of the geography. And this was the time when GE, General Electric, decided to focus on this modality called ultrasound. Thankfully, because of my good experience in ATL, I was one of those few who were in the target list. Right from day one of my job, I had a very good experience in the rural geography. And I almost understood thinking process of the customer as what they want to do to save lives. That learning brought success for me in GE, and that's why my business, the ultrasound business, was the most penetrated. GE wanted to redefine their vision as at world for healthier India. And GenWorks was born to address this. The big shift that we did in our strategy of not transacting but trying to solve for. Solving for access can happen with technology, and solving for affordable care can only happen if it's early health. This kept us going, and the team came together much closer than ever before because the impact of saving lives was in everybody's head. I can go to a single specialty, medium-sized hospital in a tier 2, tier 3 city, and I can equip them for 6 or 7 care areas. I can sell products. I can connect them to where the specialist is. I make it simple for them. Kidney problem is a major problem, all of us know. The only thing we can do is to delay the transplant, and that can only happen with dialysis. And for dialysis, people have to move from villages to towns or metro. We have a highly skilled nephrology partner, and they can remotely support for the dialysis. So these are the things which we can do very differently than anybody else. So in 2015, we started with 163 employees. We were in 30 locations. Today, we have about 500 plus employees in 170 locations. I'm very happy with where I've got to. Now, it's more than for me now. It's for the many who joined me in this journey. And of course, moving to an IPO can help us do things in scale. The 6 months of lockdown phase of COVID was the most difficult. We had about 400 people on our rolls. One thing we decided is we're not going to let go anyone for a wrong reason, and that rapidly depleted cash. When the hospitals opened up, all that we needed was access to capital to serve this demand. When we got that, we were able to serve the customers, grow our business, and now we are in a position to be able to fast track this growth.